welcome to ETimes Lifestyle, Dr. Ashok. Today, on the occasion of National Bone and Joint Day, we'll be talking about bone spurs. So, before we start the discussion, why don't you tell us about what exactly are bone spurs?
Thank you very much. It's a pleasure to be on this portal. So, bone spurs are really a very loose terminology which are largely radiological. It's usually seen on X-rays, and it is usually a little spike or a little overgrowth of bone in various parts of the skeleton. The commonest areas that you see these in the orthopedic ambient is basically in the heel. It is seen in and around the knee. You can have spurs around the hip. You can have spurs in the spine, and you can have spurs around the elbow. So pretty much any joint can have the presence of spurs. Spurs are basically just an outgrowth of a small half centimeter to 1 centimeter protrusion of bone, and typically this is caused because of protraction or repetitive activities that cause a little stress of the ligament where they're attached to bone. Having said that, some of the spurs will just appear without any obvious reason, and like I said, it's very, very common to see spurs in the skeletal reviews when we do X-rays. They're seen fairly frequently.
So, do they also indicate the early onset of arthritis?
So, spurs and arthritis have absolutely nothing in common. Spurs are not indicative of arthritis. As I said, it is almost always a radiological aberration. Asymptomatic patient gets a foot and ankle X-ray or an X-ray of the knee, and you see these little protrusions of bone. And in most situations, barring possibly the exception of the heel, these are completely benign. They're incidental findings that you normally see and diagnose when X-rays are done for that region for something completely unrelated. So, to your question, arthritis and bone spurs have zero connection.
Okay. And what exactly, like you said, in other body parts, they're mostly benign, except the heel. So, what exactly is the treatment that a patient goes through?
So the commonest complaints that patients have, and this is predominantly with relationship to the heel, the patients will typically complain of pain when they put their foot on the ground, particularly after they get out of bed in the morning. The first few steps are painful. These are not uncommon injuries in athletes and sports people, particularly when they do running and they wear the spikes. That's another cause of pain. Most often, the heel spurs are symptomatic in roughly about 30 to 40% of cases. A lot of them are present as radiological entities without any symptoms. Sometimes there may have been injury like land on your heel on a hard surface. There's a little bit of a bleeding, and that calcifies, ossifies, and this reflects as a small spur. These are sort of the causative factors. Some injuries can cause it, but like I said, in most cases it just appears because of an X-ray that you take for something completely unrelated. A lot of patients in fact have heel pains, and when you X-ray them there are no spurs, so the presence of a spur by itself is not indicative of the fact that this patient will definitely have symptoms. A lot of spurs are completely asymptomatic.
Okay. And if, like you said, most of these findings are incidental, so if they are left untreated, how can it affect the person in the long term?
It does not affect the patient completely at all. In symptomatic patients who have spurs, there are various modalities of treatment. You can do physical therapy, you can use footwear, inserts of silastic, injections of hydrocortisone, and in very select group of individuals, sometimes even surgery is indicated. If the spur is very large, we very, very rarely, particularly in elite athletes, will sometimes consider removing that spur surgically to relieve the symptoms of pressure and pain.
Okay, since doctor, we are talking about bones, what are some of the most common ailments that you see in your practice these days?
So a lot of them, particularly post-COVID, and with the enforced sort of house arrest that we've all gone through, the basic issues relate to posture and really issues of pain in the neck, the shoulders, the lower back. A lot of symptoms related to tingling and numbness in the hand. These are usually caused by repetitive movements. A lot of people have moved on to desk work, computers, laptops. So we are tending to see a lot of patients complain of tingling and numbness. It's usually caused by a condition called carpal tunnel syndrome. This is caused by compression of the nerve as it goes from the forearm into the wrist. And a lot of executives who constantly are either on the cell phone or on the computer, laptop, do complain of these. And of course, because bad poor posture, they complain of pain in the neck, or pain in the shoulders, and pain in the back.
Okay. And before we end this call, I would like you to tell us, what are some of the things that you recommend people to keep their bones and joints healthy?
Great question. As a final sort of tail off, bone health equals the health of the body. Keep your weight under control. Be regular with your exercises, and by that I mean any form of exercise that works for you. It may be going to the gym, it may be going for a walk, run, cycling, yoga, but some form of exercise is absolutely critically important. Control your weight, control your diabetes if you have diabetes, and most importantly, thyroid is a very common condition. Hypothyroid is a very common condition in this part of the world. Control your blood values, consult with your endocrinologist, and if you're able to do all of this, I think you'll have excellent bone health. And of course, the diet. Have a good, wholesome, high calcium, high protein diet, and between all of this, you'll find that you will be happy and healthy, and you'll have no real symptoms from the bone joint issue.
Thank you so much, Dr. Ashok, for joining us. Have a nice day.
Thank you very much. Thank you. Bye-bye.